Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. On our program today, we're going to be talking with pulmonary and critical care specialist, Dr. Michael Basha, and we're going to be talking about common respiratory diseases. Dr. Basha, welcome back to Today's Health.
Thanks for having me back.
What are the common respiratory diseases?
Well, there are many respiratory diseases, but some of the more common ones will include COPD and asthma, and I think we're going to focus primarily on those two things today.
How common are respiratory diseases in our area?
Well, respiratory diseases are common in this country. For example, about 8% of the country has asthma and about 5% has COPD. So that accounts for about 41 or 42 million people out of 300 plus million people in the US, so it's very common. Interestingly, in this area, it seems like respiratory diseases, including COPD and asthma, are as common or more common than in other areas, and that's for a variety of reasons.
And what are those reasons?
Well, we think it relates to a number of different factors, including problems with air pollution in this area. For example, there's high concentrations of both nitrogen dioxide and sulfur dioxide in this area. We have a lot of farmers. Farmers are exposed to straw, grain, and hay dust on a chronic basis, and that can cause farmer's lung, which is very similar to chronic bronchitis. And unfortunately, there's lots of tobacco use and smoking in this area, which accounts for the majority of patients with COPD.
Well, let's talk a little bit about COPD then. What is it?
Well, COPD is not really a specific disease. It's really a collection of diseases. And if I could sort of explain this without confusing our audience, COPD really encompasses about 7 different diseases, including emphysema, chronic bronchitis, asthma, cystic fibrosis, bronchiectasis, bronchiolitis, and small airways diseases. So those 7 diseases all fit under the COPD umbrella. And basically, these are diseases which are chronic, as the name implies. They involve the lungs, obviously, because they're pulmonary diseases. And they have in common obstruction, which means that when patients blow air out of their lungs, they cannot force air out of their lungs in a normal way. And for that reason, they're referred to as COPD, or chronic obstructive pulmonary diseases.
I think we have a picture that maybe can explain that a little bit better to our audience.
Yeah, we should. I think we have some pictures showing both chronic bronchitis and emphysema. Emphysema is primarily a destructive lung disease. There's loss of lung tissue over time, typically from tobacco use. And chronic bronchitis is more of an airways disease. There's inflammation and constriction of the airways, and those patients typically complain of cough and phlegm production, whereas those people with emphysema primarily complain of shortness of breath.
Now, you talked a little bit about causes, but what actually causes COPD?
Well, again, COPD is primarily caused by tobacco use. That accounts for more than 90% of all cases of COPD. There are some environmental things that I mentioned: nitrogen dioxide, sulfur dioxide, straw grain and hay dust. And then there's a form of emphysema that's genetic. We call that alpha-1 antitrypsin deficiency, but that's a very rare form of emphysema. So by far the most common cause is tobacco use.
Well, let me ask you vaping now. I think people think, well, I'm going to switch to vaping because that's not as harmful to my lungs. Is that true?
That's not true. There are a lot of chemicals in the vaping fumes that people inhale in. The most common is formaldehyde, and we know that formaldehyde can be very damaging to the lungs and is a respiratory irritant. So even though some people think that vaping is safe, it's really not that safe, and it does carry with it some additional concerns.
Can people of any age get COPD, or is it really an age of older people?
Well, again, since it relates primarily to tobacco use, and typically since it takes a period of time of ongoing tobacco use to develop COPD, it tends to occur in people who are a little bit older, 50s, 60s, and 70s, although it can occur in patients that are younger. For example, we have very young patients in our practice with alpha-1 antitrypsin deficiency, the genetic form of emphysema, and they can be 20 and 30 years of age.
And what are the symptoms of COPD?
Well, there's a whole variety of symptoms, but the primary symptoms are shortness of breath, coughing, wheezing, phlegm production, tightness in the chest. So patients with emphysema, for example, primarily complain of shortness of breath, whereas patients with chronic bronchitis typically complain of cough and phlegm production. But there's many overlap situations in which patients will have both of those complaints.
Now, you talked about a number of different causes, so I'm wondering if you're diligent and you don't smoke and can you prevent COPD?
Well, again, since the primary cause is tobacco use, obviously if somebody's smoking, you want to get them to stop smoking. Unfortunately, we see a lot of farmers in this area who have exposure to straw grain and hay dust and develop farmer's lungs. And so that is a condition which very much mimics COPD. And then, you know, obviously if you have the genetic form of emphysema and you're born with that disease, that's something you can't prevent but can be treated.
How important is it to manage COPD?
It's very, very important because obviously these patients can be profoundly symptomatic. They can miss days of work, they can miss school days and so forth. And so you really want to try to diagnose them properly and get them on proper treatment so they can live a near normal or normal life.
Well, we're going to come back in just a minute after this message and talk about how do you make that diagnosis.